that quality measurement. Wonderful. Thank you, Chad and Ashley, so much. Really what distinguishes Atlas is the quality measurement aspect of things. It also includes a consumer-friendly needs assessment. So basically an abridged version of what ReachMJ and the IME do with callers. Also, Atlas is not funded by providers. It's not pay to play. It has a comprehensive list of facilities, educational content, and those professional portals I mentioned. And so we're very excited about this resource. And just for some context, Atlas was started in 6 initial states that you see here. So Delaware, Louisiana, Massachusetts, New York, North Carolina, and West Virginia. And then since then, we're very excited to be expanding. And so we actually expanded to 3 states on Monday, to Oklahoma, Pennsylvania, and Florida. We'll be expanding to New Jersey. Likely the website will go live tomorrow in the state. We're still working with DHS to make sure that we're not stepping on any toes, but just to note that New Jersey is coming probably tomorrow, and then California in 2023, and more states on the horizon. And just to note for your reference, you might be saying, okay, where is the data for Atlas coming from? We have 3 different data sources. We collect information from providers themselves and we then validate. We also have a patient experience survey, so patients can leave feedback on their experiences completely anonymously. And it's not, were the beds soft, was the food good? It's to what extent did staff show respect for what you had to say? How often were you able to access a counselor as soon as you needed to? To what extent do you feel better equipped to handle daily problems now than you did when you started treatment? And also in some of our states, we include claims measures data. And so before I go into the Atlas demo, I just wanted to note that sort of the vision for New Jersey is that we see Atlas as really another tool in the tool belt, that we're looking at this is as really a no wrong doors approach. So whether somebody looks for treatment, seeks treatment with Reach New Jersey and the IME, or whether somebody comes to Atlas for treatment, our goal is to help them find the care that's most appropriate for them. And so with that in mind, I will pull up the Atlas website so you can see, okay, what does this really look like? I have it, perfect. And so I'll note that right now we're looking at the staging portion of the website. And so the actual website, let me put that in the chat, is treatmentatlas.org. And you will be able to search for treatment facilities in New Jersey, almost certainly beginning tomorrow morning. I will send out an update if that is not the case. But right now, because we have the demo with DHS later, wanted to show you what it looks like before we dive a little further. So when you go to treatmentatlas.org, you'll notice that this is the homepage. It's sort of really approachable. There's different options in terms of learning more about addiction treatment, learning more about Atlas. You'll also notice this sort of first large button is the take an assessment button, and I'll dive into that a bit more. And then we also have the ability to search directly for facilities. And so this is what will be most useful for your work with clients. So just to note for that take an assessment button, if anybody's confused or if you all have questions yourselves, the assessment is a completely anonymous assessment. It's based on the ASAM continuum of care. It asks 13 questions and it takes around 10 minutes to complete or less. And at the end, it gives a recommendation around level of care. And so I'll just give a brief walkthrough of what those questions look like so you have a sense. Those who come to the IME may have already completed the assessment, but you'll notice that it's not quite as detailed as the one that you do normally with callers. So as part of your work, somebody may have said, you know, I've answered some of these questions already, which is very understandable. They may have already completed the assessment, but you would be collecting a little bit more information from them, including around payment sources, which we don't look at with our assessment tool. And so I'll just briefly show it's asking, you know, what substances are they having problems with? Are they able to stop using? What are their symptoms when they stop using? You know, basically, do they have withdrawal? Do they have any physical health problems? Do they have any mental health problems? Have they had suicidal ideation? Are they concerned about seeking treatment for any reason? Do they have any barriers to care? Are they legally mandated to care? And then do they have transportation, a place to live and stay, a daily routine, and any mobility issues? And so just as an example, when somebody fills out the assessment on the Atlas end, this is the sort of recommendation they'll get. So it'll show the recommended treatment type or level of care. There's a little tooltip they can click to learn more. And it will also show additional services that are recommended. So in this case, given that they selected that they're using opioids, it recommended medications, also withdrawal management, given their withdrawal symptoms, and mental health treatment. And so at this point, they can search for treatment from here, or they can save the results, print them out, send them to a friend. And we just include a note that this doesn't take the place of a full assessment. It's not a clinical intake assessment, obviously. It's really just to help guide their search. So that's what a patient might see when coming to the Atlas website, or a family member or friend might see that. And on the other side, if you come to the Atlas website and you already know what you have in mind, so say you're looking for a client who lives in Princeton and they're willing to travel pretty far, they're willing to travel about 25 miles, you can type that in and search directly. And so it's a pretty standard search results page. So it gives you information. Okay, so how many facilities are there? What sort of services do they offer, or what sort of levels of care do they offer? And then you can also filter by more information. So let's say that you want to drill down a bit. You're like, actually, I want to get even closer to Princeton. And I want to drill down by, say, intensive outpatient treatment. You're like, I know that they need an IOP. And you could even go further by saying, you know what, I know that they need medications for opioid use disorder. So really the aim with Atlas is to help people understand what is the most appropriate treatment for them. And I'll show you what the profiles look like, so you can get an idea of what you would be looking at as somebody visiting the Atlas website, or what a caller might see when they visit the Atlas website. I'll actually do more search centers. And so this is a basic Atlas profile. At the top, really straightforward information about the facility, name, address, phone number. Then as you scroll down, there's a bit more information. So around, are they accredited? What types of treatment do they offer? What insurance do they accept? And I'll also show on the next page, on the previous page, that you can filter by insurance, and what are their hours. And you can share this via email with a colleague if you want, or with the caller. And as we scroll down, we see information about the quality of this facility. So I mentioned those national principles of care earlier. As you can see from this legend, this basically assesses to what extent is this facility providing services consistent with the national principles. So a green check mark is a service that is available. A yellow minus is a service is not available, but they will connect you. And a red X is that the service is not available. And a gray question mark are that data are not available for the facility. So as we scroll down, we see that this facility meets some of those standards, those national principles of care. You can click the See More button to get more information. So for instance, we see that they offer methadone as well as buprenorphine without naloxone, but they don't offer any medications for alcohol use disorder or any mental health medications. And they don't offer mental health care on site or primary health care. And as we scroll down a little further, we come to the patient review section. So if you'd like somebody to, if you want to recommend that somebody leave a review on the profile, they can just click that leave a review button. And you'll notice that there's nothing displayed yet. Reviews are published once 20 responses have been received. That's both to protect patient anonymity, but also to ensure that the reviews are accurately capturing the quality of the facility. So it's not just one or two people. Great question, Stephanie. Yes, the site is fully available in Spanish. And if you click that Spanish button, There we go. Then the facility, you'll notice the mission statement is in English, but that the rest of information about the facility is fully available in Spanish. Great question.
Excuse me?
Yes, absolutely.
Oh, I'm sorry. I think I worded that question differently than what I meant. What I meant to ask was, does it filter so that the person looking can see if the facility offers other translation services?
Yes, great
Languages other than
question.
English?
I love that. Well, I love that we answered both questions. It does. Where did I just go? There we go. Yes, there is a section to look at the different languages spoken. And I'll note that these filters expand based on the radius or based on what the facilities offer. And so you can see, does it offer, these two facilities do offer Spanish language. And also if we scroll up, we should have a section, oh, they don't offer any other languages. Sorry, this one does not, but Leave Serve Centers does. So Serve Center says other languages spoken. So this facility also speaks Spanish. Oh, sorry, I see your question. I'm so sorry, Jamina. I totally skipped over your question somehow. So sorry for that confusion. But yes, it does. In response, yes, it does show what other languages are spoken at the facility.
Thank you.
And actually, that's a perfect note that you can compare facilities side by side. So really, our goal with Atlas is not to say that there's one facility that's the best ever, but instead to say, you know, we want people to find the facility that's most appropriate for their specific needs. And so you can add up to 3 facilities to compare on desktop and up to 2 on mobile. The site is mobile optimized. And then you can compare those facilities side by side directly. And so, for instance, we see what different age or gender specific programming is available, what sort of insurance the different facilities accept. And then we can see how they perform on those signs of high quality care. And certainly I invite you to explore the site more to get a sense for what all the different options are, what all the different levels, what all the different principles of care are. So for now, with the site open, I'll pause. Does anyone have any questions about the site itself before we dive into really how Reach NJ and IME staff would use it?
I have a question.
Yes.
So how do the providers get into this Atlas program? So will all of our providers plus commercial providers be added to this?
Great question. So all providers in the state of New Jersey are listed, and then we have information for just under half of them. And so to your point, how do providers kind of get their information in? We have what's called an open enrollment period. Think like basically like health insurance. It's a period where providers can submit their information to us on that survey I talked about. We then validate that information, give them a chance to preview it before we publish it on the website. And we do include both for-profit and not-for-profit facilities, as well as the entire spectrum of treatment from outpatient, IOP, residential, and inpatient. And it is providers regardless of insurance that they accept. So it'll include providers who do accept public insurance. It'll also include providers who don't accept any insurance or who only accept private insurance or who are, say, only cash or self-pay.
And if there are changes to, so I notice a lot of times there's changes in like whether or not they're accepting clients, whether they were accepting Medicaid, but they're not. So do these providers have access to make those changes in real time?
Great question. So for, I'd say, non-service related changes, and what I mean by that is for the information basically up here around, you know, what substances do they treat for, what ages, what insurance do they accept. They can change that in near real time. It takes about 24 hours for our staff to review. For the more detailed information around, you know, how do they basically assess when somebody enters a facility, what medications do they offer, that they can update on a biannual basis. And I'll say that that's for now. In 2024, we'll be launching it so that they can update in in a much shorter window and have more opportunities for update. But for now, they can update the service information biannually and that more basic kind of facility information in near real time.
Okay, thank you.
Sure, that's a great question. And that's actually such a great point that, Atlas does not include information on like bed availability or availability of slots. And we know that that information can be really hard to keep updated. And so instead we really focus on the quality side of things. So you'll notice that that is not present on the website. Just wanted to make sure I clarified that. Yeah, the dream someday.
I have a question kind of to go on to what Stacy was asking. Like we notice a lot of times like with providers changing, like even when it comes to offering Suboxone, whether they will continue the prescription or initiate the prescription. If we notice something like Atlas says one thing, but when we speak to the provider, we notice it's not accurate. Do we tell someone, like, is there a way to document that?
Yes, absolutely. So I will put our email in the chat. But also we're in the process of trying to work out sort of a form system. So much like if a Google listing isn't accurate, somebody can report that. We're looking at, okay, how can we similarly implement a form on Atlas so that if a listing isn't accurate, somebody can report that. For now, it's done through our general email address, atlas@shatterproof.org.
Thank you.
Sure, great question. Any other questions on the site directly? While everybody's percolating, I will go back to the slide deck so we can talk about, okay, so what does that mean for Reach NJ and the IME in particular? Oh gosh. Okay. So just for some context, Atlas is being used by other call centers currently. And so it's been integrated into several helpline websites. It's also a key component of a county warm line. And you can see here an example of what it looks like on the website when somebody searches in Massachusetts. And actually, that's a pretty blurry image, but that they'll actually see a link and a recommendation to contact the Massachusetts helpline. So we're working on making a similar button in New Jersey so that when somebody searches for treatment in New Jersey, they also see a button appear, letting them know that if they want to talk to a person, they need help navigating treatment, or they want to know their funding options, they can call Reach New Jersey. I talked a little bit about the vision, but now to get into the kind of nuts and bolts. So the way that we see it, and to note that we've been working with the Rutgers team to really figure out what makes sense process-wise. But the procedure that we're looking at and really will be implemented is that after a call comes into the IME/Reach New Jersey, staff will follow standard greeting procedures. They'll determine the referral source, so where's the person calling from, identify the reason for the call, and then proceed based on referral source. So whether that's self-referrals, private insurance callers, or family and friend callers. And so for self-referrals, the staff follow the normal procedure around SUD and financial eligibility screening, inputting the client's information into NJ-SANS if they consent. And then after that level of care and funding is determined, they can then use Atlas to search for treatment for that client. And so you'll see here, this is what we saw on the Atlas homepage. You can search for address. You can filter by insurance. Also, if a client says, I'm really looking at this facility in particular, you can type in that facility's name to search directly. For private insurance callers, you can similarly search Atlas and filter by their insurance, and then offer to either connect the caller to their customer insurance carrier or directly to the provider if there's an access line. And then finally, for family or friend callers, You're welcome to use Atlas to help them search for care. And there's also different information. So in addition to that search, they can learn more about the types of treatment, a glossary about different definitions they might see. And then, of course, encouraging them to use the family support services via NJ Connect or the NJ Family Support Centers. And so just to recap that with the Atlas website, when you are on the Atlas homepage, you have the ability to search directly for treatment. So you can search for, in Princeton, and then select the specific insurance options available. So somebody may have Aetna, they may have Beacon. You can actually type in Horizon, and you can search that way. Oh, sorry, I didn't do a big enough search radius. There we go. So you can search that way. Or if you want from that homepage again, if somebody's calling about a specific facility, so if they're calling about Integrity, you can search that way in particular.
Under the insurance search, is there an option for just Medicaid, right?
Great question. So right now, the way that we have it is by managed care. There is under the payment options, you can search specifically for Medicaid. So we're still trying to sort of finagle that so it's a bit smoother. We know that that experience isn't quite smooth yet, but it's in progress. But for now, under payment options, you can click just Medicaid or just Medicare.
And that option shows up after you've already started your search.
After you've started your search, exactly. So you could start, say, Newark and Miles, and then you would search. So don't leave. Yeah, we don't
here
list specifically.
it's optional to put insurance in is optional.
Exactly. So it's optional in any case. You don't have to enter the insurance, but if that's the big factor, then you'd search and then select just Medicaid.
Okay,
exactly.
Great
Thank question. No, thank you. It's a good question. Great. And so just to recap again, for self-referrals, follow the normal procedures, and then use Atlas to discuss treatment options. For private insurance callers, you can use Atlas directly and help them filter by insurance, give them different treatment options, and then offer to connect them to care. And then for family or friends, they can use Atlas to search for treatment. And so if they're looking for a specific facility, use Atlas to help them. And then also encourage them to use family support services or NJ Family Support Centers. So looking ahead, we'll be undergoing a major redesign in spring 2023 to make the site more accessible. It's a great start, but we want to make sure that it's even more accessible, that the language is much easier to comprehend, and that it's just easier to navigate. So that's kind of far in the future, but in spring 2023, the website will look a bit different. And then after that, the website will be updated kind of layout-wise approximately yearly. Data are updated on the site. As I mentioned, for small pieces, they're updated in almost near real time as facilities want. For those larger pieces, it's approximately biannually. So with this in mind, just wanted to kind of plant the seed of the question of, we're happy to come back and do retrainings as makes sense. So just wanted to put that out there for people to think about what might make the most sense. Otherwise, I will pause there for any questions. I can stop my share so that we can see each other's faces.
Carolyn, I just wanted to ask, are you able to preview us with any of the changes that are coming next year?
Yes, great question. So one of them will be, as you saw, the insurance, making that much easier to navigate. So figuring out, does it make sense to incorporate Medicaid in with kind of the private insurance and make it sort of one giant insurance offerings? Also, we know that in some states, Medicaid goes by a different name. So for instance, in California, it goes by Medi-Cal. So looking at, does it make sense to list it differently? Also, we've heard from clients and stakeholders alike who say, okay, what if I don't have any money whatsoever? Like, what if I was just released from prison? And so I can't cash or self-pay. I just have no ability to pay, making it much easier from that end of things. Also, we are looking at how to best format the site for people who are looking for treatment urgently. So if somebody's saying, okay, I'm ready in this moment, I don't have time to search, compare, I just want to know what facility is open right now that can sort of speak to me immediately. So figuring out how to structure the site in that way. And then we'll also be looking at, and these are just a few sort of pieces, and lowering the reading level of the site. Right now in practice, the site is about at an 8th grade level, which we know is much higher than it should be. And so working on making sure that the content is much more accessible. And then lastly, I'll say looking at translating the site into other languages. So right now it's just available in English and Spanish. We'd like to expand beyond that. And that's just a snapshot. And there's a few more pieces coming into play, but those are the big ones.
So for us here, we provide, I'm sorry, Sarah, did you want to say something?
No, go ahead.
Okay. We provide state funding. So there is a list of state funded programs. Would that be in the program listed under state funding?
Yeah.
Or
so
uninsured, maybe?
Let me just pull that up right now. So that would be under uninsured, so like no insurance accepted, for instance.
And then the state funded programs would come up if you chose.
I believe so. Let me
Okay.
check right now. Oh, gosh.
And just to kind of clarify on what Stacey's saying, do you consider state funding like not Medicaid? Because a lot of places we say state funding and they just consider that to be Medicaid. More specifically, I think she's referring to places that don't take any Medicaid. And I just was curious if that's what you guys categorize state funding as, like not Medicaid, like absolutely no.
Correct.
Insurance.
So we think of it as separate from Medicaid.
Thank you.
I don't believe it's ever going to show you fee for service funding. However, that's going to be done through our existing databases.
Right, that's actually what I was looking for, fee for service. Okay.
Yeah, you already know how to do that.
Yeah, but I was wondering if they were going to do a search for fee for service, like a family member or something, and do their own comparisons.
Well, and that's why we're expecting this kind of an interface, right? Because they're going to get to a certain point on that where they need something that they can't get off Atlas, and they're going to see the banner for Reach New Jersey, and they're going to call us.
Yeah.
And then we're going to, because we have all the tools for that piece.
Yeah.
And we're going to be able to check their Medicaid, because a lot of people are wrong when they think they either have it or don't have it.
Okay.
When you
Right. So in
mentioned,
this instance, yeah, if anyone has an issue with the Atlas website, our number is going to be posted right there to be able for anyone to just ask any follow-up questions or further troubleshoot any sort of issues.
Shannon, you had a question?
yeah, can you hear me?
Yes, go ahead.
Oh, I was going to ask when you mentioned within the future having an option where people can seek immediate services, which is something we often get on our line, but can't always accommodate because wasn't aware that there was any such thing as such like immediate services. So what do you mean by that exactly? What will be available to clients who are ready in the now and want treatment? And, typically for us, sometimes a bed's not available.
Great question. So one organization that we're working with both in California and more broadly is California Bridge, that focuses primarily on emergency rooms, which I realize may not be, like that right away appointment, but does get someone to somewhere where they can then, for emergency rooms that offer that service, where they can then get triaged if they have a substance use disorder that can be treated with medication. They can initiate medication at the emergency room
Oh,
and then be
okay.
linked to further care.
That would be wonderful. Yeah, there's a lot of times we get people who want something immediate. And sometimes immediate is there for treatment, and other times, the recommendation, for something like benzos or alcohol is the emergency room, because that is going to be, what's always available to you. So I was just curious what you meant by like immediate, services.
Yeah, exactly. I know that's sort of the ultimate question, I'll say.
Yeah, thank you.
Sure.
I also have another question. Brian, you might have to help me ask this. What I'm trying to say, with the insurance, with Medicaid, there's like 3 special cases, like a special case population. So how would we search that in Atlas, or would we still have to refer them back to the Medicaid?
You're only going to get that through EMIPS. You're only
Okay,
going to get, whenever any of this comes our way, we're still going to do what we always do, which is look you up in Medicaid, just to be sure, right?
so in those situations, we couldn't use Atlas.
Well, we can use it, but it's better to know than kind of send someone down a false trail, right? So we're still gonna do what we do, which is look you up in EMIPS to be sure.
Okay,
Because
and what
a
if,
lot of people say I have Medicaid, and half the time they don't, and half the time they say they don't have Medicaid, and then half the time they do. And then there's that smaller category of I'm a special population Medicaid, which no one client-based is going to know for the most part. So that's why we have to look it up.
But if
okay,
we
and
do look it up and see that it is managed Medicaid an option for reviewing? As if I put in specifically managed Horizon, would that come up as an option, that they're in network for that managed program?
Managed is at the point at which you're going into managed special population Medicaid, you're in the kind of the same realm as commercial insurance, which means to be sure they need to contact their MCO. But some places like places that accept commercial insurance might be able to ascertain that through their access center. So it's worth a try there if they want to do the provider directly thing rather than spend however much time they have on their phone on hold with their insurance company.
And we do include information on managed care in Atlas. And so I'll just show you what I mean. So from the homepage, then if you type in managed, you'll see that there are different managed care plans. So for instance, Amerigroup New Jersey, or if you type in Horizon, you'll see Horizon Health Managed Care.
And then that's linked to the providers that accept that insurance, right? Caroline?
Exactly.
Perfect. So this way we can connect the caller right to that facility because we'll already have that information in Atlas.
Yep. And mention to them when we connect them, like, so yeah, this is a FIDE SNP or this is an MLTSS plan, and do
Yeah.
you take that? Because they'll have some familiarity with what that means, hopefully.
Yeah, and
and
I
then
think
what,
I'll go for
sorry.
it. No, go for it.
I was just going to ask about the clients who have the QMB plus Medicare, Medicaid. What would we search for that?
That's the same. We've had better luck with that with commercial insurance providers than anywhere else. Anyway, I mean, we'd still need to follow the same carve out rules about whether it's an MCO or not. Like what the plan codes 200 and 204, it's managed plan, then it needs to go to their MCO.
Okay.
But I mean, some of this will, this will be an interesting experiment because it's a very small category, but it's a very troublesome category. We may finally figure out some things that we've been wanting to know for years about this category just by having access to more of a provider list in the realm of commercial insurance. And Alyssa, you're going to be the point person for this since you get all those calls.
Thanks, Brian.
So the other thing for the staff is I wanted to encourage everyone to just go to this site and play around, like play with the treatment locator, play with the assessment questions, try entering different things and see what kind of results you get, and just get generally familiar with how to navigate it. Just kind of like you did with NJSAMS in the beginning, you want to be proficient in this, right? You want it to be kind of effortless once you start doing it. So play around with it now. And anything that you're confused about or having an issue with, or getting a result that doesn't make sense to you, Donovan and I are available to talk to anyone about it. And if we can't figure it out, we will call Carolyn directly and we will figure it out.
Yes, absolutely. Please let us know if you have any questions. Also, I know that this protocol is not set in stone, and certainly we're happy.
Carolyn, you said Thursday you guys will be up and running for New Jersey. Tomorrow, that's tomorrow. Tomorrow, you'll be ready for New Jersey.
All right, sorry, my headphone died. Could you repeat the question,
Yes,
Donovan?
you said tomorrow, New Jersey site will be, New Jersey will be up and running, so we'll be able to do that. Excellent.
Yes. Any other questions, comments, concerns?
I'll ask one more, sorry.
Oh,
So-
no apologies.
When our callers call in starting tomorrow, should we tell them about Atlas? Like when they're asking about their treatment options and we're giving them their list, should we then tell them about Atlas and how to use it?
Brian, Donovan, I'll look to
Yes,
you
we
two.
should always refer to Atlas because it's a partnership, and let them know about the site, and absolutely always let them know that we're getting the information where we're getting it from, which is Atlas. So that, yes, we would do that.
Yeah. And also be willing to do that for them, right? So there's two ways to go with that. Either we're going to go to Atlas and we're going to do the comparison. Some people may not have access to a computer easily through their phone or whatever, in which case we're going to do it for them and we're going to discuss, what we're seeing. Or if they want to, say research it on their own and call us back, we direct them to the site, tell them to call us back, we'll send the referral.
Thank you.
And this could be good for people that like that review thing. It's nice to have a place where they can actually have a solid quality check, because that's always the one question that I kind of dodge for people, in terms of like, well, which one is better? How do you feel? Like, it's good to give them like a reference point, like just check out Atlas and let that kind of do the work for you, type of deal.
Exactly. That's really our hope, that people ask that, want to make it easy for them to say, hey, you can compare your options directly.
All right, I guess we're good. If people have additional questions that you think of once we're done with this, there's the other session at 3:30, is it? Feel free to log on to that as well.
I think it's at, let me confirm, at 3 p.m. sharp.
Good.
3 sharp. Okay, very good. Perfect.
Well, thank you all so much. I put my email in the chat as well in case you want to reach out directly.
Thank
Very
you.
grateful.
Thank you. Thank you,
Caroline.
Caroline. Have a
Okay.
great day, everybody.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.